Hi, everyone. This is Dr. Jennifer Hobson. I'm here to teach you about the third session of the breathing clinic, the Hobson Institute Breathing Clinic. This is all on uh, neurology and the cranial nervous system. So I'm going to go ahead and share my screen. And Dr. Harvey, can you see neurology and cranial nerves? Yeah.
Yes, I can.
Okay, perfect, perfect. All right, so let's just run through this presentation. You've got cranial nerves. We all have a brain stem that has these 12 cranial nerves. If you'll notice, the front of the brain is here, and this is the back of the brain and the cerebellum. So it goes from 1 to 12, and the olfactory is the one closest to the front of the frontal bone. This is basically if you were to take your head and cut off the top and pull out the brain and lift it up. That's what it would look like. So it's 12 cranial nerves, one on each side of the brain. The cranial nerves are responsible for a variety of motor and sensory functions. The first two originate in the cerebrum, the bulk of the brain, and the other 10 are from the brain stem. And just quickly, what do they do? The olfactory nerve, its function is to smell. So many of you might have heard of a friend or a colleague or loved one that stopped smelling. So that's the olfactory nerve. And from my learning, it's not good that that happens, that kind of creates an altered function of the rest of the cranial nerve. So we want to try to stimulate your olfactory nerve. And many of you might have gotten all the different supplies. And let me see if I can pull out my neti stick. The neti stick is something that I highly recommend. You can get it at Whole Foods. It's part of the supply list that I gave you. But just by putting it in, inhaling throughout the day, it kind of keeps your nose open. For those of you that have sleep apnea, this thing wakes you up. So if you're at a meeting at work and you're tired and you're feeling like you're going to fall asleep, activate your cranial nervous system and smell a very nice smell like the neti stick. Now, optic nerve is number 2. That's a sensory function. It's vision also. So you want to, there's a bunch of eye nerves. So the cranial nerve number 3 is the oculomotor nerve. And its motor function is to constrict the pupil and move the eye. The cranial nerve number 4 is the trochlear nerve, also eye movement. The trigeminal nerve, I'm sure you all know all about the trigeminal nerve. There's 3 branches. It's both sensory and motor, so you have the facial sensations. Depending on the area that you have altered sensation, it might be the ophthalmic, the maxillary, or the mandibular branch. Its function is to chew, to activate the muscles of mastication. And basically, one that has a lot of clenching problems has a hyperactive trigeminal nerve. So we're going to learn how to calm that nerve down with a few exercises. So here you have the abducens nerve, moves the eye left and right, motor function. The facial nerve, this is my daughter here. She's showing you all the different facial expressions. So it also gives you tongue, the taste of the back 2/3 of the tongue. It activates all those facial expression muscles, and it also has influence on the salivary and the mucosal glands. Now, the vestibular cochlear nerve, if you've ever felt dizzy, this is the nerve that gets affected. It's the nerve number 8. It's in charge of hearing and equilibrium, balance. Very important nerve. And just know that if you have some vertigo issues, there's therapy for it. Our office does vestibular therapy, and we have 3 trained vestibular therapists that are excellent at restoring inner ear balance. Cranial nerve number 9, the glossopharyngeal nerve, it has both motor and sensory functions. It gives you the taste of the first third of your tongue. It also activates the salivary glands, and it activates the tongue for swallowing. Also innervates parts of the throat. Vagus nerve number 10, that cranial nerve, is very important. This one is so important to calm us down. It forms part of the involuntary nervous system, including it makes sure that our heart rate is constant. It also helps control digestion. It gives you the taste in the back of your throat and the root of your tongue. It innervates part of the throat as well. And it allows motor control of the muscles of the throat to keep the throat open. It stimulates the muscles and organs in your chest and your trunk. And it also helps move food through digestion. So this nerve, knowing where it's located, it actually passes the back of our throat. It's the longest cranial nerve. It goes all the way and connects to all the organs. It calms us down. It moves us from fight or flight to rest and digestive mode if you can activate it. So we're going to do a lot of humming exercises. Humming allows that nerve to get stimulated because it passes right where you vibrate your throat with the hum. Now, the spinal accessory nerve, that's nerve number 11, know that that nerve controls the muscles of your neck. It allows you to rotate, flex, and extend your neck. So it's the one nerve that actually connects outside of the head to the sternocleidomastoid and the trapezius muscles. So guess what? When that nerve is hyperactive, our shoulders are up near our ears. You ever felt like you had a patient that, or knew someone that just was always uptight and had their shoulders high? That nerve can become hyperactive and create that tension in these muscles. Now, this is the hypoglossal nerve. The last nerve is nerve number 12. It also moves the tongue. So it's mainly a motor function nerve. So what are we doing with these nerves? This is something I learned from a woman called Dr. Lois Laney. I'm going through the process of her breathing method to get certified, the Laney restorative breathing method. So there's reflex activation, development, and integration of all these 12 paired cranial nerves to support the voluntary and involuntary movements, thus maximizing the balance of growth patterns. And we want to optimize the autonomic nervous system. So when balanced and in harmony, basically the brain is working properly with all the automatic functions that we take for granted. So your autonomic nervous system is your voluntary nervous system. You all probably know this, and it includes your fight or flight sympathetic nervous system and your parasympathetic nervous system, your rest and digestive nervous system. So this is the homunculus. The homunculus is basically a map in the brain that different areas. So you'll see here, it's a somatosensory cortex, and this is the motor cortex. And it just basically, the different areas of the cortex control different parts of the body. And the map really of that part of the brain is dedicated to either sensory or motor processing for different anatomical divisions of the body. Parts of the body are represented based on how large a part of the cortex is engaged in that sensory or motor function. So you'll notice this, you'll see that there's a lot in the lips and the tongue, the ears and the eyes, everything here, all the senses are nice, and there's a lot there, and the hands, but the rest of the body is not as included. This is more for this homunculus map. Now, how does this all work? By working these reflexes, your autonomic nervous system, and these 12 paired cranial nerves, if you can get them all to work properly, you're going to slow down your breathing. And that's the whole point of this, is to make sure that we calm down our nervous system so that we breathe nice and gentle and, nice and smoothly, not erratically, and, either through the chest or through the mouth, kind of holding our breath here and breathing fast. all of that is not a good cranial nervous system function. We want to make sure that we breathe nice and slow. Through the nose, slow and low. Remember that. Okay, so remember what I said, we breathe 20 to 30,000 times a day. If you're in my office, when I'm testing someone with a capnometer, a little measuring tool to see how fast they're breathing and what their CO2 levels are, they're breathing in the 20s. And really, we want to breathe an optimal breath, natural, 8 to 10 breaths per minute would be perfect. To be most efficient, 6. Remember the first session we talked about how 6 is about 5 liters of air exchange to the lower lobes of the lungs. Okay, so this is based on the Laney restorative breathing method. You'll notice that this is the posture I would want you to sit in. A nice straight 90-degree here, 90-degree here. What is she holding? These are little pom-poms, we call it, but they're squishy things. They're like stress balls. Why is she holding stress balls? To calm down her nervous system, right? So the nervous system likes to be calm. And the little focal point, you'll see a little emoji here. This focal point is basically for the eyes to focus. Remember, we had several cranial nerves that if you've ever seen someone that can't look you in the eye, they're all over the place. Their cranial nervous system is out of whack. So we want to train the eyes to focus on one thing, and the brain likes yellow. That's been proven that the brain likes yellow. What are these? These are ear plugs. We're going to plug our ears to close out all the other sounds, so that you're doing this exercise with no sound. So what are we doing here? This is you can do it laying down. You can do it seated, like you saw in the picture. You can do it side lying. It's great to do it at least once a day when I am doing like a big presentation. If I'm going to stop the share for a second. So if say I'm presenting in front of, I don't know, 300 people, sometimes I get nervous. Well, I do this exercise to calm my nervous system down. If I'm, not that I have a hard time falling asleep, I don't, but sometimes if I have something on my mind that I can't get it out, this is the exercise I choose to do at night. And when my husband hears me humming, he knows what I'm doing and he just lets me be. But I will do it in the position of sleep. And when my brain goes and I can't stop thinking, I have a little smiley face right next to a nightlight in plain view of my side. We take turns, by the way. Every 3 months we switch sides of the bed so that my left side gets compressed for 3 months and then my right side gets compressed. So I have 2 little smiley faces on either side. Then what I do, hold on a second. I know it's funny, but you gotta try what works, right? If you have a hard time falling asleep, this exercise works well. If you're stressed out, if you're nervous, it gets all of the kinks out. You'll see. Okay, so it's recommended to do this with a popsicle stick, with a what works really well is a Starbucks stick, one of those green sticks that they put to stop you put it right under your tongue and between your teeth with your tongue up like that. Okay, but I can't do it right now while I'm teaching you, but that's the position, right? If you have a popsicle stick, if you have a tongue blades work too. Some people don't like the wood in their mouth, but the plastic ones work well. Okay, so this exercise is actually to improve your cranial nervous system in your brainstem to help reestablish the correct neural pathways in order to function optimally. So here's the position again. And in a second, we're going to practice it together. If you want to do it, you can do it. I'm going to put out a big emoji so you'll see it in the middle of the screen, but you're going to focus on it. Your teeth are going to be apart with something between them, like a stick of some sort. So you're going to focus on this little focal point. Why is it so goofy? Why is this such a, you know, it's not like a scary, I don't know, like Nightmare on Elm Street or Jason. I mean, I'm dating myself, but something scary would make your nervous system scared. Your brainstem, I'm going to stop share for a second. Your brainstem is always looking for safety, whether you know it or not. You walk into a room that you don't know anybody, and your brainstem is saying, am I safe? Am I safe? Am I safe? To itself. And you're looking around and, okay, no, I'm good. I'm good. So what I'm trying to create is an environment for my patients to feel safe. Okay. So here it is again. You're going to focal point. What does that do? It engages the cranial nerve for the eyes, the 2, 3, 4, and 6. You're going to use earplugs. Okay. You're going to use earplugs to block out cranial nerve, the vestibular cochlear nerve, 8. You're going to put a stick between your teeth under your tongue to relax which nerve? The trigeminal nerve, nerve 5. So for those that clench their teeth, I make sure they have something between their teeth. So anytime the teeth touch, it sends a stimulus to the nervous system, and it keeps you in fight or flight. Humming, we're going to hum. That stimulates that vagus nerve. And then at the end, we're going to swallow. And I want you to know that swallowing, not many people swallow properly, but that the cranial nerves 9, 10, and 11 fire with swallowing. And I'll stop share for a second. Swallowing, when I do this, I'm going to have, put the stick at anything and put the tongue above it, Dr. Cantor. Tongue on the spot behind the front teeth. So don't bite your tongue, put it up there. Yep, that's fine. You're going to breathe in. You're going to pause. You're going to hum. At the end of the hum, you're going to swallow with this in your mouth. Now watch my throat. Did you see it? So I don't want to see patients that do this. A lot of pursing here, a lot of, you want, I call it the invisible swallow. So all it is the tongue is ready to go and it goes, gunk, gunk. None of the facial muscles should be active. It should be all the tongue and the constrictor muscles kind of getting that swallow down. So let's try this. Hold on a second. Now oh, you know what I mean? I'm going to have you do this. Hang on. So let's just review real quick. Tongue up, sit up straight, tongue up, stick between the teeth, tongue up above it. Your eyes are focused on the focal point. You're going to breathe in, pause at the top, hum gently but kind of loudly. Yes. Yes. And at the end, you're going to do a swallow. And some people say, oh, I don't have a swallow. I don't have a swallow each time. Don't worry about it. If you don't have a swallow each time, don't force it to happen. You're going to crane your neck when that happens. You're going to try to purse. Inhale again. Okay. So we're going to do this 10 times. Let me just, hang on. I'm going to get my little emoji out. Open. Here we go. Right. I know this is goofy. All of this is goofy. I got to tell you, the Laney restorative meeting, it makes you do some weird stuff, but it calms your nervous system down. Here we go. So look at the emoji, stick underneath, and let's practice this. And you guys, I hope you practice it, because what's the point? I mean, inhale, pause, hum. And by the way, when I do this with my kids, every night I do this with my kids, they give me at least 3, and then I try to get 2 more hums out of them. They start like this. They hum like all crickly, crackly, and by the end they're so it's like all that tension, all that pent up, you get it all out of you. It's like you're giving in. You want to give into your body. You want to give into your nervous system. You want to hold on to this tension. All right, here we go. Stick. Breathe in. Pause. Hum. Invisible swallow. Gently breathe in again. Pause at the top. Hum. Invisible swallow. Gently breathe in. Pause at the top. Hum. Two more. Okay, gently breathe in. Pause at the top. Hum. Invisible swallow. Gently. Last one. Breathe in. Pause. Hum. Invisible swallow. Okay. So what are we doing here? Just know that that humming, if you like to sing and hum a tune every day, it is very healthy to calm your nervous system down. You can't be that upset when you're singing, right? When I love it when I hear my dad sing because I know he's in a good mood and he's happy, but you want to activate that vagus nerve. Too many of us are uptight and go. We got so much on our plate. You need to learn how to calm yourself down. Okay, and life is not all about work every day. It's not. All right, I'm going to keep going here.
Do you use earplugs when you do this?
Listen, when I train it, I will train it the right way. When I'm using it the most, I go in a quiet space. If I'm about to present, I will focus on, you have to focus. That's the key. Like you can't just do it in your head. That's why I have a little smiley face in like on the wall near my bed. You have to focus. I don't even get to 10 hums and swallows when I'm trying to fall asleep. By 8 I'm okay. But if I'm learning it and teaching it to someone that has a lot of cranial nerve issues, it's best to do it with the earplugs in and the stick and the emoji yellow. Okay, so just know that every single part of what we just did has a turning off or turning on of a nerve that is not working well. So we want to kind of integrate our cranial nervous system to function properly. And us breathing, just remember, people overbreathe. They breathe too fast, their chest breathe, they mouth breathe, they breathing too much. So that ramps up your nervous system. It slows you down. You're taking your time to do this. You're doing it only through your nose. Every time you breathe in, hum, and it's a slower breath. You can't breathe fast and do this. All right. So swallowing, remember that I don't want you to feel like every single time if you come down to the bottom of the hum, if there's no swallow, inhale again. It'll come naturally the next time. Okay? So don't make it happen. This one you're not going to be able to do that well, but you can do the covering of the nose. This is called single-sided nasal breathing on the foam roll. This exercise, the way I've been taught is that you've got to keep checking your nose. I'm going to stop for a second. Cover one nostril. Cover one nostril. And don't compress it under it. Just breathe in and out. Give it a rating. Like how congested are you on that side? I'm probably if the 10 is completely open, I'm probably a 7. I cover the other side. That's better. I'm an 8 on that side. Remember, I'm narrowed. I've had a deviated septum corrected, but I'm still narrowed, right? So I use my breathe rights. I use my mutes, these guys, to open up my nose at night because I'm not having a bad night's sleep. I'm going to sleep well. All right. So I'm always testing my nose. Always testing my nose. I want to see, is my right side getting air of my brain? Is my left side getting air? And if it's not, what do? Don't forget, I taught you this the first
Yeah,
time.
yeah.
Remember the
Yeah.
inhale? This is also Lainey. She taught me how to do this. You inhale. I'm swallowing it. It's going all the way back and going down and also waking me up. So this I get for my sleep apnea patients. I have them do this 3 times a day. Here, and then I blow my nose. But if you're not cleaning your nose, know that you probably are not breathing well through it. Clean it. Check it. Right and left. Now I'm better.
What is that container?
Okay, look it. I'll include the supply list again, and it's called Deep Sea. And just know that I don't care what kind of it's a long applicator. This is the reason why Dr. Laney really likes it. It's because it goes all the way to the nasal valve. Dr. Cantor, I take all this out. I put distilled water or filtered water, and I put a little sea salt. That's it. So I'm always cleaning my nose, and my mouth breathers, they hate it, by the way. The beginning, it burns because they're not really using their nose. That surface of their nose is all, it's not used to salt water rinsing. And my right side that had gunk in my CBCT for years, and I was never really sick. It was just how I was. First time I did it, it burned like anything. It hurt when I did it. So just know that it's a process. Now I probably do this at least twice a day. And I like, look at, I do, this is all on the supply list, and I'll include it in the notes this time around, okay? This one, remember, don't forget the nasaline. It's called the Vaseline. You inhale, you put it over, there's a little bulb that goes and you shoot and it comes in. It's like the neti pot kind of thing. The Neil Med, I don't care. Clean your nose once a day, but this thing can go to work with you. This thing can go in the car with you. This thing, if you're a mouth breather, if you know that you are a mouth breather, you got to keep your nose clean and you got to try to keep it open. All right, I digress now. I've lost my train of thought. Okay, so let me go back to the presentation. Oh, single-sided nasal breathing. All right, so look at this picture. I have a fork in my mouth. It's the same thing as a stick. So you got to get the stick. She's all about the trigeminal nerve relaxing with the stick. Okay. Then you're going to cover one nostril. And like if you want to do it a major way, I'm looking at a focal point on the ceiling. Okay. So I do this. And if you have an inhaler, it just amplifies it. So I'll do it a couple of times with the inhaler, without the inhaler, and then with. So cover one nostril. And you know what? I'm going to share this guy. You got to focus on something. Cover one nostril, gently breathe in. Pause at the top, hum. Gently swallow, invisible swallow. Gently breathe in. Pause at the top, hum. Gently swallow. I'm going to do this one with my Medi stick. Gently breathe in. Pause at the top, hum. swallow. Switch sides. Okay, you're going to cover the other side. Focus on the focal point. Gently breathe in. Pause, hum. Gently swallow. Gently breathe in. Pause, hum. Gently swallow. Now I'm going to do it with neti stick. Cover the same nostril. Gently breathe in. Pause, hum. And gently swallow. Now, with your tongue, after you're done, those 3 and 3, you do everything. The brain likes 3s. Everything's done in 3s. Tongue circles. Put your mouth closed. Put your tongue tipped up. I want you to do 3 counterclockwise circles without moving your jaw. Disassociate your tongue and your jaw by just doing 3 circles, not touching teeth, but just the palate. Like this. So take the stick out of your mouth, Dr. Cantor. So you do 3. And then pause, go the other way. Okay, so what are we doing there? You know what, the majority of patients that clench are low tongue postures and clenched. What is doing this do? When you cross midline, your right and left side of your brain have to communicate. It kind of resets you. You're not going to clench when your tongue is doing that. So I want you to, when you're trying to do this exercise, it's wonderful because you're going to work on making sure both sides are working. You're going to calm your nervous system down because you've got the humming going. You got your trigeminal nerve under much more relaxation. And then you're going to synapse the 3 cranial nerves that swallow at the end of each one. So it's like a reset of your brain. So I need you to understand that this is goofy, but clenching all day is not, it's a real thing. People do it and they're ramped up. This is a way to calm them down. Okay. Now, I like doing on the foam roll. I do a ton on the foam roll. If you got a terrible posture, the foam roll is, we went over some exercises last time that really will help open up your chest. Like people are, especially Dr. Harvey, you're probably looking down in surgery a lot. You don't want this part of your back to start being so curved or kyphotic. So backward bending over foam rolls are awesome, awesome exercise. So here's the exercise. And I'll give you this exercise in the email I'll send you. All right. 2 more exercises left. 2. This is the utensil exercise. Now, we talked about the Malampati score last time. Malampati scores are basically, you want to look in the throat of your patients. If you cannot see their soft palate, or I'm sorry, if you cannot see the airway under their uvula, they've got an issue, then this exercise can help them. So if you have a fork, if you have a spoon, I like a spoon or a fork. She uses all 3. I don't really like the knife. If you're going to use the knife, don't use a serrated side. Use the non-serrated side. So this exercise, just so you know, the tongue for a lot of patients is down. We're trying to restore proper oral posture. Airway support. Tongue should be up against the entire blade should be up, not hard pressed, but gently up. So what I want you to do, you're going to stick a spoon, a plastic fork. That's the best thing to do. You're going to scrape 3 times as far back, and hopefully you gag a little bit so you activate those nerves too. It's not, those hyperactive gag reflex people need all of this all these exercises. That means all their cranial nerves are out of whack. This will help those patients. So you want to scrape 3 times. And then you're going to turn around. You're going to scrape 3 times here on the soft palate. You're going to get your teeth with the tongue always above. Breathe in. And swallow. Again. Scrape 3 times on your tongue, Turn it around. It's teaching you where's your tongue supposed to be. Now get your tongue up there. Feel that soft palate. Close your mouth, tongue up, breathe in. Hum. Relax your lips, Dr. Cantor. Relax your lips. And then swallow. So if you do not see your airway, what is it doing? It's saying, okay, no, the tongue should be up. You should feel that soft palate. And does anyone ever know what the back of their tongue feels like? No, that's why you're using this. You're getting it stimulated. You're stimulating that. Say, hello, tongue. Turn around. Hello, palate. Meet each other. Breathe in, hum, get that vagus nerve to calm it down, and then swallow. Okay? Now that's what this exercise is. We just did it. First you do it with the fork, then the spoon, then the knife. So 3, 3, and 3. What is the end product is that your tongue knows where to be in your mouth. And then perform silent breathing from that point on. The goal is to get the tongue up, supporting the airway, and then breathing silently. These exercises will help your proprioception and give your tongue and palate sensory stimulus to feel where they should be in contact. And resting when your mouth is closed. The goal is to have the entire tongue up to the palate to help support your airway and initiate swallowing in the correct position. So consider people do not swallow right when they're always clenched. Okay, so this is the 3 exercises, or the tongue, the palate, put it under the tongue, tongue up, hum, breathe in, hum, and swallow. Okay, let me stop for a second.
Why do you use both the spoon, fork, and a knife?
She does everything in 3s. It's just to change the texture on the tongue, to stimulate it in a different way.
Okay.
I like the fork. I don't have a fork with me right now, but I like the fork the best because you can really feel it. It's like 4 prongs. So yeah, sleep apneics need it. If you have sleep apnea, if you cannot see your airway too when you open your mouth. We went through all the airway exercises last week. Remember, don't forget the arc, the onk, the caw, all those opening throat. And then remember, sleep apneics tend to have like a fat tongue. You want to tone it by sticking out your tongue, making the sides come in. Practice that. And then I like to disassociate the tongue and the mandible. So waggle spot, we call it. All my tongue-tied patients would be like shifting their jaw right and left because they're tied. You want to disassociate. You want to have a complete, that your tongue, lips, everything is flexible to articulate, to swallow right, to have relaxed chin and neck and jaw. Okay, so we've talked about the purpose of all this is to calm down the cranial nervous system and to get you back into fight or flight, out of fight or flight, to rest and digestive mode, parasympathetic mode. We talked about a stick between your teeth to calm down the trigeminal nerve. Earplugs to calm down the vestibular cochlear nerve. Breathing in and pausing and humming and slowing down our breath and stimulating that vagus nerve. Okay, so all of that is important. We're now scraping to feel where our tongue's supposed to be. We're swallowing with the most gentle way so that we don't get TMJ and we're not activating all these muscles. We swallow 1,500 to 2,000 times a day. You better believe that if you're grimace swallowing or craning your neck each time, you're going to have neck and jaw problems. All right. One of the exercises, you're going to laugh at me, and that's okay. Because this is the last neurological exercise I'm going to give you. And this one is if you have an issue with balance. And as we get older, we all get issues with balance. One of the most important things that I do is dance. I dance twice a week, sorry. I got a very, very good dance class that makes me turn in circles and walk backwards. And believe me that we lose that ability if we don't challenge ourselves. So this song is going to be called Happy. Happy by Pharrell. Why? Because you can't not be happy when you hear this song unless you're annoyed by it because you heard it too much. This song makes you happy. So I'm going to teach you a move. Oh, come on. Hang on. What's that song? Okay. Skip ad. All right, here we go. So I'm going to have the song playing in the background. Okay, now let me move my computer around for a second. I'm in my son's room, by the way. With everybody doing e-learning, everybody's everywhere. You might see some Harry Potter stuff in the background. Okay, so this is a dance that activates your brain, okay? And this is, if you want, I'm gonna have my leg showing a little bit. So you need space because you're going to kick and you're gonna move, all right? And I'm gonna send you a link if you ever want to practice this. You can practice. I'm good at it now, but I sucked when I was, when I first started. Believe me, this is not easy. All right, here we go. This is if you want to work on your balance. This is the brain neurological presentation. So, all right, right hand ahead, and it's like a prong. You're gonna feel your hand like that. Left hand goes to the opposite knee. Opposite foot behind me, out to the side, all on one foot, forward and backward. Switch sides. Remember, you cross right and left brain. You have to communicate. This gets your brain working. Knee, opposite foot, out to the side, forward and backward. Switch sides. Knee, foot, out, forward and backward. Knee, foot, out, forward and backward. That's one. I'm going to do it double time right now, okay? This is how you want to eventually do it. Mouth is closed, tongue is up the whole time. Nose breathing. Okay. All right. So that was my little demonstration. All right. So listen, let me just sum it all up, okay? I've been doing this breathing clinic since 2013. It has been, it's kind of like my passion now, because I just realized, I've been working with TMJ patients for years, and so many of them I could help, but there was a portion that just didn't stop clenching. And I learned all about tongue tie. I learned all about myofunctional therapy, how to swallow gently, how to breathe through your nose. I learned that I wasn't nose breathing. I learned that I was a mouth breather. I learned why all this happened to me. And I'm on a mission to help as many people learn how to be healthier, because the breathing is where it's at. If you haven't read Breath yet, read it. It is a fantastic book. Where's my breath book? I need you to know that this book sums it all up in such a great way. And there's so many
It's
good
upside
things.
down.
Huh?
It's upside down.
Oh, thank you. James Nestor, he put it all together in such an easy way to read. It's not new stuff, but we keep ignoring it. This is where the health is. Okay. And one thing I wanted to show you, and let me see if I can pull it up real quick. Okay, let me see if this will let me. I don't know, because it's on a different screen. Course bundle. Okay, so let's see. Come on, Jenny. Okay.
TMJ patients who
So here I,
could not.
oh, this is not going to let me do it. So just know that, no, this isn't it. I'm going to stop share for a second. I'm going to stop share for a second here. Okay. So Thinkific, welcome. All right. So tell me if you see this. Okay. I hope this works, because what I want to share with you is the online version of what I just taught you. Here. Okay. So this is, and I'll send you the information. I always, when I teach my dentists, I give them a very reduced rate for this. This is not the code I want you to give to patients, but I will give you a very reduced code to go through this. And there's 3 breathing clinics. This is one of 3: restoring the nose breathing, breath volume, and rate. This is a do-it-yourself. Find out if you, can you all see this? Dr. Cantor, do you see this? Do it yourself. Find out if you have a breathing problem. This
Yes.
one's free. You don't see it?
I do.
Okay. So this one is free for anyone to see. There's a couple tests that'll tell you got a breathing problem or not. This is a coronavirus free practical exercises that I do for patients that are dealing with that. This is session 2, myofunctional therapy and posture. And session 3 is the cranial nervous system. So let's see if it'll let me. So this is session 1. Get started. It's all videos. This is all the supplies that you will need with all the links. You just press on it, it'll tell you. There's a bunch of forms. I always have people start with the sinus nasal form, the Epworth sleep scale, the Nijmegen. There's always kind of a baseline I'd like to get people in. There's the presentation. All that we went through, all the presentation is there. This is the overview of concepts that you will learn. Reduced breathing. Remember, we did a bunch of different types. I don't expect people to do all of these. You pick one you like, but you can learn all of these. These are all different types of ways to reduce breathing. And they're all like videos. So index under the nose. And you can't hear me right now, but
It's breathing.
there it is.
There's several ways.
So I'm just showing you this because it took me a long time to get this done. And I think, sometimes people can't come to your office. Sometimes people can't do a Zoom call. I'm doing these on Zoom calls now, but this is a way for them to learn this at their own pace. You get it for 6 months. And the breath holding, the different types of breath holding, the technique to reduce, anxiety attacks, coughing attacks, the different step exercises, how to improve your breathing at night, nasal dilators, breathe right strips, the mute, taping your lips, the different types of tape, how to properly wear a mask. Some people don't know how to wear a mask. You dentists probably do. Hopefully you're not mouth breathing behind that mask. Remember the whole tongue thing? How to breathe in mask for children. Children, hopefully the mask thing will go away soon. I hope. But that's that's the first day, the first session. The second session is this one. You've got the myofunctional introduction. There's always an introduction of me
Airway
explaining
exercises
what
to
it's
improve
about.
the space.
You got the dashboard on the left, and it just goes through everything, what we're going to go over, what you're going to need, supplies. The exercises that you get from me are all on here, like the list of all the different descriptions, the presentation, myofunctional therapy, the review of the exercises, the explanation of what the tongue does and how it supports the airway, all the airway exercises to open up your throat, the GoPex. Remember the GoPex for me? That program, I just had another child sign up for that today. And it's a great way because people cannot come to the clinic. So you want to do stuff online with them. That's all through online. All ways to straighten up, to straighten your body, because we're kind of compensating for bad postures at work. All my daily exercises that I recommend for straightening up. Sleep recommendations, how to set up the pillow. There's a video on what I recommend. Okay. And last thing is the one we just went over. Okay. So I'm going to give you a code that makes this $50. And I want you to go through it. It'll be a great review. What you will need, this one, earplugs, hand mirror, popsicle stick, pom-poms, the presentations there, silent breathing, humming and swallowing, utensil exercise, then my crazy Lois stance, we call it. She'd make us do that when we're learning from her. She'd have us stand up and start that dance to wake up. Your brain has to work really hard to do right and left and crossing and all that. So listen, any questions on all this?
Yes. Why can't you clench with your tongue touching your hard palate?
Try to.
I can do it.
It's really hard, Dr. Cantor. It's not the normal position of the tongue when we clench. It really isn't.
So people who really want to clench are going to have to drop their tongue.
Those people.
That's a more efficient way.
It's more an efficient way to clench.
Yeah.
If you think clenching is efficient.
No. I mean, if you're going to do a dysfunctional movement,
yeah,
it helps if your tongue is low rather than if it's high.
Yeah.
Right.
Yeah. And one way to know that, a lot of patients that have a lot of plaque right here in the lower incisors, that area that you always have to scrape a lot, those are low tongue. So know that
Was it low
that
tongue?
those are low tongues, the tongue that's pooling the saliva right there.
Okay.
So that's
And the other thing, I was under the impression that the tongue will expand according to the amount of room it's got. But you are saying that you can actually slim it down, contract it.
you can make it skinnier. The tongue, when you're growing and your bones are growing, it spreads the mouth as wide as the tongue is and should be. It's when the tongue is dangling down, it's never pushing on anything to grow. You want your mid face to go forward so your nose isn't like a bulldog,
Right.
and you want your jaw to move forward so it's not choking you in your airway.
No,
That's
but I'm saying if a edentulous patient, a lot have these huge tongues because they expand into the area that the teeth were previously.
that there's no containment. There's no
Right.
no right.
Right. So what you're saying is there is a way to keep your tongue in proportion to the rest of your mouth.
Yeah, I mean, right now I've gone through a little expansion as an adult with something called the ALF. It's not like the DNA, RNA appliances that are out there that are like big things that actually grow bone and widen things.
Yeah.
So I'm a little bit wider, but my tongue still doesn't fit. I'm a bicuspid extraction case. Anytime you pull out teeth, you're shrinking your face, you're shrinking your mouth. So I'm my sing, I'm trying to push that tongue up between my teeth and I'm still not fitting back there. So I'm at risk to snore and have sleep apnea, but I'm doing all these exercises to make sure that I'm jamming it up there. I'm trying to keep
Wait a second. You want your tongue wider, is what you're saying?
No, I want my jaw wider. I want my maxilla wider. I want the space when you're an adult, when that's why it's so important that pediatric kids learn how the tongue should support their craniofacial development. Once you don't have space, the tongue falls down.
Right.
It's gonna go down, and then the back of the throat, soft palate falls because there's nothing lifting it. So that's the issue. And so I highly recommend any kind of expansion. I do not love rapid palatal expansion. I don't love it. I like more of the ALF if they're young enough. I like the bio block. That's that whole mid face growth, not only wide but forward. Get the nose out too. So anyway, listen, if you have any other groups that you think this would be interesting to,
Oh,
I
yeah.
love teaching this stuff and I love connecting to people that are interested in it. There's some people that listen to this and think it's crazy, and there's others that want to develop more of a team like approach and understand that the health of a patient is not just one person. A lot of times you got to figure out what that person needs to accomplish what they need for their health.
Right.
And I'm not a dentist. I need you all. I need you all so bad to understand this and to really advocate for your patients. Patients don't, and everybody doesn't know they're breathing bad.
No.
Everybody, and I know if I look in the mouth of a patient that's totally tight and lots of dental work, that they're clenched and just breathing in fight or flight all day long, really rapid through their chest. That is not, they're going to end up with a heart attack or a stroke. That's what ends up happening. So we need to, this breathing clinic, I love to teach. I love this online program. I'm hoping that you all will help share this with people. It's important to me, and there's nothing really out there like this. So this sums up everything. It's like not just slow and through the nose, it's the myofunctional, it's the humming, it's the brain work. Okay.
Okay.
So listen, I'll send you the notes. I'll send you the code. I'll send you the other code to send to patients. And I will send everybody on your study club, Dr. Harvey, kind of an introduction of my clinic and what we do, just so that you know. And a way to if you wanted to refer a patient, a referral slip that's easy, that has the addresses on it. We're in Lakeview and we're in the Loop, and we do telehealth, because remember, telehealth is covered by insurance now. So those myofunctional therapy cases, we can help. Just
Wonderful.
like Dr. Harvey, remember that orthognathic case, that young
Yeah.
man that you sent? He did amazing. He did amazing. And like, when they really want it, they're the best patients. They really, like, they've spent a lot of money, a lot of time off work, orthognathic. He got it. So thank you for this opportunity, and thank you for your listening. And I hope you got something out of it. I appreciate this time.
It was
Thank
excellent.
you.
Thank you.
Thank you. It was wonderful. Thank you so much.
You're welcome. You're welcome. Take care now. Bye-bye.
Bye.